Welcome to BackWords. I'm Dr. Dan Francis. Tonight we are in Plymouth, Wisconsin at my office, and we are talking with Tammy Limbach. She is a Rolfer from the Port Washington area of Wisconsin. It's, again, the focus of BackWords is to try to educate people on different healing modalities that they can use to help themselves stay healthy and well. And Rolfing is something that, number one, is not a lot is known about to the lay public. And number two, there are a lot of misunderstandings for those who actually have heard of Rolfing. So Tammy is fabulous. I have used her myself, a card-carrying member, and she has helped my daughter quite a bit, and I've referred a lot of patients to her over the years. So on that note, Tammy, welcome to the show.
Thank you.
Yeah, it's my pleasure to have you here.
Thanks for doing the show. I think this is really great.
Well, thanks. It's a lot of fun. We've been having a lot of fun doing it. And awareness to people like you and the different modalities that hands-on healing has to offer is really neat. Yeah. So why don't you tell us a little bit about your path? Because you're not only a Rolfer, you do yoga instruction. And
I do a few things. I teach yoga. I teach yoga to the public, and then I also teach a yoga teacher training. So I think that melds really well.
So you teach the teachers?
I teach the teachers. I create the teachers as well. So that's really fun. But I think my background in yoga melds really nice with Rolfing. So the two of them together, I think it's like a great marriage. It really helps my clients because Rolfing is a form of body work, but then when you put a little bit of conscious movement on top of the body work, it really helps the body work kind of stay inside of the person's experience.
So conscious movement means yoga.
Totally.
Right.
Tai Chi, but yoga for sure.
Yeah.
Yeah, at least that's my experience because that's what I do.
Yeah, and there's so much healing that happens when you just move your body.
Consciously.
And really, when you look at Rolfing as a body work, and a lot of people say it's a different type of massage, but it's not.
Yeah.
There's a lot of differences, and we'll get into that. But when you treat a patient, you want to treat them and then see them go and use it, right?
Completely, yeah. And I think that's one thing that's different between massage and Rolfing. I mean, I'm not a trained massage therapist, so I can't speak to massage, but I think that's one thing that's really interesting about Rolfing is Rolfing works with fascia.
Yeah.
Where I think like chiropractic works with bones and massage therapists work with muscle, but Rolfers work with fascia, and it's like the casing of the whole body. Like the whole body is held together with this interweb of fascia that's like this plastic molding almost that gives us our shape and allows us to move or not move with ease or.
To be gross about a thing, but it's almost like the capsule around a bratwurst.
Totally.
Right? I mean, it's sort of holding the muscles in shape, and it's holding, and people understand the fascia by, that's myofasciitis, that's fibromyalgia, that
plantar fasciitis, exactly. So there's a lot of like itises, which is inflammation that comes into the fascia. So I feel like my job is the way I describe fascia is like an orange, but I might steal the bratwurst one. That's a good one. So my job when I'm working with the fascia is just to like feel through the body and find the areas that there's adhesions or areas that the fascia isn't elastic as it could be, because it happens through unconscious movement, if you have an injury, and then posture is such a huge thing. Yeah. And that's one thing I really want to talk about with this too, is that I had a Rolf who kind of like invented or founded Rolfing, obviously the name Rolfing. She studied biochemistry, she studied chiropractic medicine, she studied yoga, she studied osteopathy, and then she started studying consciousness as well. And what she found through her own experience, like personally in her body, but then also working with her family members, is that like when you stand in a posture that's upright and supported by gravity, like not only are you going to feel good in your body, but you're going to like feel good like in your being. Yeah. Like you're going to have more confidence, you're going to feel more emotionally able to deal with like the stressors of life.
You could see that in dealing with people. The people who are confident tend to be well-postured people. They're open. It's almost like a lot of people who are non-confident adopt a physical nature to promote that.
Yeah, and it's not coincidental. You know?
When you talk about Ida Rolf, there is just one Rolfing school, correct?
Yeah, well, there's the Rolf Institute in Boulder, Colorado, and then there's a few different structural integration schools. And we all basically use the same recipe, like the same series of sessions, but we all have like our different names. So I can say I'm a Rolfer because I graduated from the Rolf Institute, but a lot of it is from Ida Rolf's gift that she gave us, her work and her studies.
So when you go off, it's is that a year schooling?
It's a year schooling.
And it's out there, so it's not like
there.
like a massage therapist. There's a lot of massage therapists in Plymouth and the surrounding area.
Yeah.
They can sort of maintain a normal life.
Right.
Run down to Milwaukee and
Take
to
the classes.
massage, but that doesn't work for Rolfing. You have to donate a year of your life to become a.
Yeah, you do, and I don't know if that's good or bad, but it is what it is, and I'm happy I got to spend a year in Boulder. That wasn't too shabby.
Never bad.
No, not at all. But yeah, it's a great place to spend some time, and the schooling it's some of the best teachers I've ever studied with. So
that's every day.
Schooling. Yeah.
Everyday thing.
Yeah,
Okay.
It's an intense program, and I think a lot of the real learning happens when you start working with bodies. I'm sure you can say that from your studies too.
It's
like you
amazing.
Go through school,
I mean,
yeah.
you get the knowledge you need to get out there, but until you start working with patients and bodies and that information you get, but also managing the patient interaction to help the person.
Completely. So yeah.
So when a new patient comes in, what are the main types of things you treat?
Sure. I mean, I treat anyone who's looking to inhabit their body deeper. So when you talk about that consciousness thing, when people find Rolfing through maybe their psychotherapist or something, like they'll come to see me because like neuroscience is now finding that memory is actually in the body. It's in the fascia. It's not so much in our brain where we think. So I get some clients that way. Going through emotional releases that can happen with Rolfing, or people just that have chronic aches and pains, people that want to work on their posture because either they're going to go into some line of work where they have to have a more upright posture, whether it's like acting or even singers, professional athletes. I get a lot of professional athletes. So it's across the board. It really is across the board.
I used Tammy, I think, first in one of my Ironman triathlons. I'm not built like a runner. And nor do I run like one. And I just could feel that my mechanics were off, and I would try different techniques, and they wouldn't work. And I remember coming to you, and the adjustments helped. That helped, but it was like I'd get adjusted, and it would want to go back. And when you freed me up, I remember this one run. I had to do a 20-mile run, and I looked at my time when I was done. I was like, "Wow, that's not me." You know, it felt really easy. You know, I could tell the mechanics just totally changed after you worked on my pelvis and
completely. And that's what a lot of people say after getting Rolfed. They'll say either they feel more grounded and connected to earth. Sometimes they say they feel lighter in their body, but they almost always say I feel more freedom in my body, like more freedom for movement. And when I hear those stories, it's like, yes,
yeah, that's success.
I love it. Yeah, to feel better in your body, like what is better than that?
Yeah, it literally is a freedom. You know that, and we've talked about this on our show a lot. When you're moving, it's not just helping your body, your physical, musculoskeletal body, but it's helping your organs, your brain, because that blood flow goes throughout.
Yeah, and then even deeper than that, like your emotional well-being, like when your physical body is as efficient as it can be, you can handle so much more even emotionally.
Yeah.
It's like crosses the board. So it's so important, the work that you do and the work that a lot of these modalities are doing.
Yep, they do. So when you're working on someone, when you're working on the fascia, how do you differentiate between the muscle and the fascia on the body?
Yeah, that's a great question. They're almost like different languages. Fascia is like it's like speaking with a Southerner compared to like somebody who speaks like a New Yorker. I guess like a New Yorker would be more of the muscle, and the Southerner is a little bit more of the fascia. Like the fascia moves slower. So there's a patience that comes with like as the client. There's a patience like we're gonna move really slow when we work with fascia. And there's different layers of fascia too. So with Rolfing, it's a series of 10 sessions, and we move from the superficial layers of the body and we start moving into the deeper core layers of the body. So we'll move from like external chest, pecs, the backs, the outer hips, and then we start moving to the deeper layers like inner thighs, always all the way up to like the skeletal muscles too. So that's the way I would describe it to people. Is it's a slower language.
When you say there's a series of 10 sessions, do you start in the same place with every patient, or is there a puzzle that way, or do you sort of start on a need-based?
Yeah, I guess it depends on what people are coming for. I love to work with the 10 sessions. We Rolfers, we call it the recipe. And it's not so much like work the shoulders, work the pecs, work this. It's more like what is getting in the way of this person breathing the fullest breath that they can breathe. Sometimes it's people's hips. Sometimes it's tightness in the ribs. Sometimes it's the shoulder. Sometimes it's the neck. So whatever I can see or feel in my hands, like what is getting in the way in the first session of this person experiencing a full breath, that's what I'm going to work on. And then the second session is usually like feet, shins, like how can this person get a nice contact to floor and earth and foundation? Because if those two things aren't available, all the rest of the things we're going to work on later won't stay.
When I'm working with people with walking or hip issues, where a lot of times you go right to the feet. And I always use the example that you wouldn't go to the top of the Sears Tower if they didn't have a good foundation.
Completely.
And it's like the tires of your car. It's the only part that touches the earth. And it's really important.
So important. Yeah. If like the feet aren't functioning, if the arches aren't functioning well, everything else above it is going to be thrown off. So. Yeah, so there's sort of a protocol and there's a general outline, and every now and then I get kind of like wily and decide I'm going to go off the recipe, and then I always look at the body that's in front of me and I'm going to work on what's presented, and invariably I end up following the recipe anyway.
She's a genius then.
Oh my God, so smart, like connected to something bigger, Yeah.
So are there trap areas of the body that tend to always be hung up? When you start working on someone, is it something in the core? Is it something in the shoulder because of the typical postures?
Yeah, classic. It's like neck, shoulders, rounded shoulders, tight pecs. A lot of that's going on because we live in a culture like this. Another classic, I used to say it was mainly for women, but I'm finding it's really for women and men, is we don't have a lot of core stability as like Western people. So we tend to stabilize ourselves through the outer hips and the glutes, right?
Yeah.
And so those get really tight, and then to change that pattern takes a lot of like consciousness awareness and loosening up all those tight spots so those core muscles can start to engage. Because it's not like we have to do a ton of like ab work. Like,
you don't.
No, like if everything's functioning.
And most people do it wrong. Exactly. It's like, exactly, crank it on their neck.
Exactly.
Crank it on their neck.
If like a lot of this stuff, a lot of this like outer tight stuff that we're using for core stability, if we can get that more open and loose, like again, if that fascial web isn't like this, if we can get it a little bit more
work.
It almost like just can turn on automatically.
Well, giddy up. So what we're going to do is we're going to take a break, and when we come back, we are going to watch Tammy do some Rolfing and see what it's all about. We're talking back and we're talking sitting posture. Of all the positions, lying, sitting, or standing, sitting is the worst posture. When they've done studies in tribes in remote areas that have no chairs, they have almost zero incidence of low back pain. Sitting doubles the pressure in the disc. So as soon as you sit on your sit bones, that torques on the spine and creates much more pressure on the disc. And especially because a lot of times when you sit, you're slouching or in a chair that doesn't have any lumbar support. And what you get is you get more tugging on the muscles and the ligaments and a lot of discomfort. Especially with someone with a disc problem or a nerve radiating down, sitting is very, very difficult on the spine because it increases that disc pressure. So get on your feet, stay active. We'll be right back. Welcome back to BackWords. I'm here with Tammy Limbach and my daughter Elizabeth. She's our guinea pig today. She's not a guinea pig, actually. She's had quite a few Rolfing sessions. She's got some scoliosis, and Tammy has helped her out a ton. So Tammy's going to start to show us what she does.
Yeah. So when I have a person come into my office, I'll start just by having a nice conversation, how they've been, and I'll watch them walk. And what I'm looking for when I watch people walk is like, where is the freedom in their body and where is the non-freedom? And I almost want to work both aspects. Like the place that already has freedom, I want to capitalize on that, and the place that doesn't have freedom, I want to use the place that does to almost educate the place that doesn't. So what we were talking about before.
So you use the strong part to support the
Totally.
weak link.
Yeah, so much of Rolfing not only is like working with fascia, but it's also like educating the system a new way of being, like a new way of like posture, like we were talking about before, like educating this whole body how to like stand in a nice right upright posture. So using the parts that already have freedom to teach the parts that don't.
Great.
So we were talking about how this is an area that tends to be a stabilizing area. So when I work on people in this area, I'll often just start just touching and feeling in for the spot that feels the most maybe sticky or adhered or whatever that may be. And you can see I'm just kind of like tugging on the spots. I'm not trying to massage or loosen anything. I'm just kind of like listening. And right here on Lizzie, probably about like glute medius is a spot that's a little bit tougher. So I oftentimes use my hands, I'll use my knuckles, or I'll use my forearms or elbows.
So, Tammy, you're tiny. I'm about 185 pounds-ish, give or take. How much do you weigh?
120, 125.
Yeah, so you're using body angles and just leverage totally to deliver this force.
Yeah, completely. And if I wasn't aligned in my body, I'd be sinking, I'd have no force, so I really have to make sure I'm like really...
It's almost like a yoga workout for you, huh?
Completely. And that's what I love about it.
I do yoga when I'm treating people.
Yeah, it's the best. And I find that like as people are healing, it's like I'm healing too, which is I think a
good energy.
Good equation. So here I can feel her body start to accept my pressure. So once that happens, I just soften and I just try to tug a little bit on the spot that doesn't want to have a conversation yet.
So when you say accept the pressure, I think what you're getting at is you feel like the muscle just sort of acquiesce and give.
Yeah.
Or not of the muscle, but the fascia.
Well,
but
yeah, the muscles
they resist with their muscle
completely
if it's a little uncomfortable.
Yeah. So the layer I'm getting at is almost like right below that. So I'm working through the muscle. If I was working more that really high superficial layer, I'd come in with the palm of my hand to the skin. Don't mind my cold hands. Sorry. And yeah, here. And like I said, the fascia has a different pace of conversation. So I tug in the direction the fascia should be going in, and I wait for almost like, you know, when you have a plastic bag and you just slowly stretch it. That's kind of like the same thing here.
I've noticed that with your moves, like when you're getting a massage, you know, there's a lot of activity by the therapist.
Yeah.
You sort of get in and just sort of hold, and I've
Completely.
never asked you this because we're usually talking, but
Yeah.
you can feel the difference that way.
Completely, and they're both for different reasons.
Yeah,
Right.
but a lot of people are looking at this as, oh, it's just another type of massage therapist, but you're really working on a different skeletal tissue here.
Completely, and totally different intention.
Yeah.
Like I'm not looking to help people relax. I'm not looking to help.
It is relaxing though when you're having a treatment.
Sometimes people want to punch me. Not all the time. And that's one thing I say too. Like I think you were going to get to that before. The whole idea that Rolfing's painful. It does have a bad reputation.
It does have a bad reputation.
It does have a bad reputation, and I think that's for a lot of reasons. But it's not necessarily comfortable all the time receiving the treatment, and I think that's because like to ask anything to change or really transform, it's not comfortable.
Yeah.
So there has to be a little bit of discomfort. I never want there to be pain.
But you walk that border well.
Thank
I mean,
you.
I've had massages where you just got to say, that's enough, uncle.
Right.
And you don't go there. Yes, there are points where you hold your breath a little bit, and boy, when you let go, it feels good. But, I mean, I have people who've been to Rolfers that they say, well, if there's no pain, there's no gain. And that I don't think is correct.
Yeah, I totally don't agree. I think that's like trying to move the fascia too much too fast. I don't think it has to be painful.
Well, and if you're creating discomfort to a level that the patient resists you, that hinders your own progress in what you're trying to.
Completely, because we're like we said, we're trying to re-educate this body, and if we teach this body to tense when pressure comes to it, that's like the last thing we want to do.
You're just reinforcing the mechanisms it already has. This pelvic area is such a key area of the body because not only are you distributing your force through your legs, but a lot of locomotion comes through the pelvic area. it's involved in the breathing and obviously the support of the upper body. And the breath is everything, because we're not here if we're not breathing, right?
Yeah, completely. Yeah, I totally agree. I think the pelvis is like a huge player. Another interesting player is the 12th rib. I'm sure you're familiar with that too. 12th rib, it's the bottom rib, it's not attached to sternum. There's all sorts of muscular fascial connections, and same thing, it's involved with digestion, breath, and that's a spot right at that 12th rib that tends to get really gunky on people. I don't know if it's because we sit so much.
Well, it's a transition too. The 12th vertebra to the lumbar. Whenever you go to transitions in the area, skull and neck, neck to thoracic, thoracic to lumbar, it's like mixing oil and water. There's
completely.
It's always a major
spots.
change in the vertebral shape, plus the free rib as the 12th rib.
So when I get to that guy, I'm usually using finger pads. I don't ever want to get like too pokey. And supporting front and back, almost like the body can start to feel a container. And then just, again, it's like that, it's such a conversation when you start to work with fascia or connective tissue, waiting for it to accept me and then just telling it maybe what a new option could be.
Do you tie into the breath at all?
For sure. Yeah, for sure.
Into that movement, because I could see when she breathes, you could sometimes sort of settle in a little more.
Mm-hmm. Yep.
So you have to be very patient as a practitioner.
Yeah. Yeah. I think my husband would say it's probably helped my patients at home too. Which I think is a good thing. Yeah, it is. It's a patient kind of practice.
Mm-hmm.
I like that.
There aren't many Rolfers out there, are there?
No, there's not. I think in southeastern Wisconsin right now we have about five. About 5 of us. And I think it's partly because of the schooling, like you said. You have to give up a year.
It's hard to donate that time.
Completely. And usually the people getting into Rolfing are adults, so it's after you've already established some career that you want to switch from.
Yes, you got to give that up and make a year out of your life.
Mm-hmm. Mm-hmm. So just innately, I'm going to the other area that tends to be tight. Right through traps and neck and all of this shoulder complex.
And Lizzie has a scoliosis, so her curve goes this way, so that adds, scoliosis is the curvature of the spine from the front, so that adds a lot to the angst that she has in an area that's already pretty troublesome on a lot of people. Is there a time that you typically hold, or is it given when the tissue releases for you?
It's totally the conversation of the tissue. Yeah, good question. No, I find like if you stick too hard to protocol, it loses the magic, you know?
Yeah, I would imagine. Are there body types that are hard for you to adjust? Or not to adjust to...
your kind of body type. Exactly. It's true, though. It's like the very strong athlete. The fascia is so used to being held in a certain position because you've trained it to support you in this activity, because the function that we put our bodies through creates the form that we put our bodies in. So when you train it to be like tough and enduring, like you are a hard one. But it's fun. It's still able to, but I would say that more than anything.
That's called Wolff's Law. When you put a stress through the body puts resources to it and strengthens it. That's what you're doing when you lift weights. You damage it so the body builds up. And so the more athletics you do, the tauter the fascia gets. And anyone who's ever cut up a deer or anything like that in wildlife will realize that fascia, when you look at it and how tough it is, it's unreal.
Yeah.
I mean, you need a sharp knife to get through that, let alone change it with your hands.
Thank God this fascia's alive. That helps.
A little more dynamic,
Yeah,
isn't it?
exactly. Can hydrate a little bit easier. So right now I'm just working along the curve of her spine, just right in here, clearing out. There's a bunch of muscles along the spine, the erector muscles, that like to get a little bit gummy along the spine. So just clearing that out so, again, the spine has nice free motion.
And if you heard her, she said they're hydrated more. Muscles and skeleton and fascia, they need water. You know, that is the number one nutrient in your body, so it's real important to hydrate. One of the quick and simple ways of keeping hydrated right is making sure your urine is sort of a clear tone versus yellow. If it's yellow or looks like Karo syrup, you've got some hydration issues, and you'll get a lot more musculoskeletal problems as a result.
It's true. It's true.
So she's going in, you can't see it, but she's got her fingers like this, and she's going right in like that. And if you see she's driving that line of force, that's called self-preservation there. Exactly. I use a lot of techniques like that where I use elbows or knuckles or straight arm where you could use body force.
That's good. And you can feel it start to just like open. It almost feels often like a yawn in a certain sense, like the body's sort of like yawning, like accepting it.
Yep. So if anyone's ever had exposure to Rolfing, this gives you a good clue. I mean, there's different areas of the body that she works. I'd say some of the most tender on me have been in the calves, and probably from a lot of the errant running form I had over the years. But there are different fascias all throughout. But it's amazing what this tiny little thing can do to help affect your health and well-being.
That's nice. Yeah, and I think one thing too that I love about Rolfing over physical therapy, I know there's a lot of great physical therapists out there, but what I think is really great about Rolfing is I end up working on every part of the body. Because let's say somebody has a problem with their shoulder, and maybe it's from the way they use their mouth, but maybe it's the way they're walking, which is throwing off their hips, which is causing their rib cage to be torqued in a certain way.
It's really a domino effect, isn't it?
Completely. And like, this is a whole system. You can't just look at one thing and think that that's going to cure it. It's a whole system. So Rolfing ends up working with every part of the body. So I think that's like the huge benefit of Rolfing as well.
Yeah, and that's real common. People come in and say, I have a problem right here. And when you start working elsewhere, they look at you like, did you not hear me right?
Right.
But you do. But I don't want to temporarily fix it to see it go away. So
yeah, I had a person come in just the other day, and she's like, my thumb's weird. And I was like, okay. I knew I wasn't going to work on her thumb that day, but we worked on her spine, we worked on her shoulder, and she emailed me the next day, all my thumb pain is gone.
Gone.
Yay. Yeah,
well, Tammy, thanks so much. You are awesome. She's just
Thank you.
fabulous, folks. And we thank you for joining in. Until next time, we've got your back.